Ready? Good afternoon, and thank you for tuning in to this community briefing on COVID-19 and our local efforts to prevent the spread. Joining me today is interpreter Margie Propp. Thank you so much, Margie, for being here. And I want to note that today is Interpreter Appreciation Day. And not only do I want to thank Margie, but also Sharon Sinkler and Francis Beaurivage for their work to make every one of our press conferences accessible to our deaf and hard of hearing residents. Thank you again so much. And thank you as well to the media and to our residents for tuning in to find out how you can protect yourself, your loved ones, and our community. We want to remind everyone to visit our website, covid19.lincoln.ne.gov, where you can continue to find out more updates and access to resources to help navigate these turbulent times. In addition, we have a data dashboard at that website that is updated twice a day, once in the morning and once in the afternoon, where you can find out more information about our cases and the health department's investigations of them. Today in Lincoln, we've had a total of 23 individuals test positive for COVID-19. We reported this morning that 6 individuals test positive, and since then, another 17 individuals have been diagnosed. And that means that of the grand total of 462 confirmed cases in Lincoln, 269 of those, or 58%, have been reported in the last 7 days. Before I turn this over to our health director, Pat Lopez, I'd also like to call attention to the fact that today is National Nurses Day, and we here at the city would like to recognize all nurses, including Pat Lopez, who is a registered nurse. Pat has a big nursing anniversary this year. Congratulations, Pat, on the 30th anniversary of receiving your master's degree in nursing from UNMC. Nurses play a vital role in our society, and that has never been more clear than right now. As CHI St. Elizabeth ICU nurse Camry Werning said recently about what nurses are doing to take care of their patients in the midst of this pandemic, quote, "There's an increased importance on taking care of both the mind and body. We're providing holistic care right now because we're often these people's only point of contact." I hope you will all take a moment to reflect on what she said and on the value and importance of our nurse healthcare providers, the incredible services they're performing day in and day out under stressful and hazardous circumstances. If you want to express your gratitude on social media, you can use the hashtag National Nurses Day. And now I invite our nurse extraordinaire and health director, Pat Lopez, to come forward to share more about the health department's investigations of our local cases of COVID-19.
Thank you, Mayor. I am one of many public health nurses at the health department, and I want to take this time to recognize them as well as the 11 school nurses that will be joining us tomorrow to work on contact tracing. This contact tracing is vital to public health during a disease outbreak. Nurses are helping with this critical work all across the country to protect our communities from further spread. I also want to thank all the nurses in the community for being so dedicated and resilient and for ensuring everyone has the care they need. No matter the day or circumstance, nurses are there to make a difference, and we have seen countless examples of their hard work and compassion in our community, our state, and our world during this global pandemic. Our contact tracers in particular are helping reduce the spread of this virus by identifying people who were in close contact with an infected person and providing instructions and guidance to quarantine. They also work with employers to explain the process and importance of following their guidance. Our investigations have identified 174 Lancaster County community members who are positive cases related to the Smithfield plant in Crete. 104 are employees at the plant, and 70 are family members or other direct contacts. Those 174 cases represent about 40% of all the lab-confirmed cases in Lincoln. Again, that plant is in the neighboring Saline County, but we have many Lancaster County residents who work there. We have no new cases at the Smithfield plant here in Lincoln. We still have 9 positive cases related to that plant at this time, 6 employees and 3 of their direct contacts. In addition to seeing an increase in the number of positive cases, we have also seen the expected increase in the positivity rate. As we test more widely for people who have symptoms, the overall positivity rate for Lancaster County is now up to 9%. The state's rate is up to 17.8%, and the national rate remains at about 18%. Today, the hospitals report 43 COVID-19 patients. That includes 5 from Lancaster County and 28 from other parts of the state. 7 patients are on ventilators, and that includes 2 from Lancaster County and 5 from other parts of the state. Our hospital capacity in Lincoln remains healthy. As we look ahead, we all need to understand until we have a vaccine against COVID-19, we will need to continue to take precautions. As long as most people lack immunity, resuming our normal activities will bring more infections. That is part of why any changes we make in our strategies to contain the virus must be made gradually. Health officials will continue to monitor new cases in specific outbreak areas and do the necessary contact tracing. We'll continue to look at the availability of testing and the capacity of our healthcare system. As we need the public, and we also need the public's help more than ever to keep everyone in our community safe.
Thank you, Director Lopez. And just a clarification again about the number of patients in hospitals. That's 43 COVID-19 patients, 15 from Lancaster County, and 28 from other parts of the state. And as we go through data like this every day, we recognize that all the new cases and new numbers are people in our community, our friends, our neighbors, and our coworkers who are directly impacted by the virus. We all need to move forward together, respect each other, be kind, and help protect one another as we evaluate when to resume activities that we've placed on pause. And for now, we urge everyone in Lincoln to stay the course, as we are not out of the woods yet. While many other parts of the country are leveling out, our curve is still on an upward slope. This is a time for vigilance. We encourage everyone to keep physically distancing and wear a face covering around others. Stay home as much as possible, leaving only for essential trips to get groceries, medications, or exercise. And please wash your hands often with soap and water. If all of us take these common sense precautions, we will help our whole community move forward and avoid taking steps backward. Testing continues to be an important strategy in fighting COVID-19. Bryan Health and CHI Health St. Elizabeth drive-through testing sites completed 224 tests Monday, and that's about 75% of their capacity. So again, there is room for more testing to be done. If you have symptoms of COVID-19, you can get tested. The process starts with an online risk assessment at chihealth.com or bryanhealth.com. Next, we want to spend a little time discussing the new guidelines for reopening faith-based services in houses of worship, as well as the guidelines for reopening farmers markets. As you know, Governor Ricketts issued a statewide order that allows worship services to resume in person as of May 4th without being subject to the 10-person public gathering limitation. And to ensure the safety of worshipers and the public at large, the state has also made clear that houses of worship must follow state and local guidance regarding these services, and that guidance is available at our website at covid19.lincoln.ne.gov. And here are a couple things that we want to highlight from that guidance. If you're a faith leader planning to host in-person services, it is vital that you urge those who are sick or at risk to stay home. This includes the elderly, people with underlying medical conditions like diabetes, and then family members who live with the elderly or people at risk, people with access to long-term care institutions, people with COVID-19 symptoms, of course, and people who have been exposed to someone with COVID-19. Please advise your staff, your volunteers, and congregants to check their temperatures prior to participating in a worship service and to remain home if anyone in the household registers a temperature of over 100 degrees or otherwise displays COVID-19 symptoms. And again, you can see the expanded list of symptoms at the CDC website or at our website, covid19.lincoln.ne.gov. We encourage faith communities to continue to use virtual services to enable those who cannot be physically present at a house of worship and allow them to remain connected with the larger community. In addition, houses of worship must be configured so as to maintain appropriate physical distancing. This means that seating must be arranged to allow congregate households, staff, and musicians to be at least 6 feet apart from each other. It also means that lines to receive communion or lines for entering or exiting a house of worship should be carefully managed so as to ensure appropriate physical distancing between people. We encourage houses of worship to add additional service times to allow for appropriate physical distancing, to use overflow rooms and drive-in services where appropriate, and provide signage and extra volunteers to help explain physical distancing procedures. There are also a number of precautions that need to be taken with respect to sanitization and disinfection. Seating, doors, restrooms, and common areas must be sanitized between services. Any person involved in the distribution of communion must first thoroughly wash and sanitize their hands. In fact, if you're planning to host any in-person services at your house of worship, you should have hand sanitizer and sanitizing products readily available to anyone entering the house of worship. We urge everyone who goes to a house of worship to wash their hands or apply sanitizer upon entering the facility. And we strongly encourage everyone to wear face coverings when they enter a house of worship. This is one of our best strategies to prevent transmission of the virus and to demonstrate love of neighbor. Due to the public health risks, the following activities will not be permitted during this time at houses of worship: the passing of baskets or items between persons, the use of sacred books, hymnals, and other materials that remain in a house of worship for general use, the use of a common communion cup, nursery services, public gatherings or social functions outside the bounds of the worship service, such as congregational potluck meals or programming that involves more than 10 people in an enclosed area. We note that funeral and wedding services must adhere to these guidelines, and receiving lines for these services are not permitted at this time. Finally, we want to acknowledge that the reopening of faith-based services held in houses of worship should not be interpreted as a lessening of the threat of the coronavirus. Faith leaders are responsible for the safety of those who attend services in houses of worship and must act according to their own judgment, wisdom, and discernment, and with attention to our local conditions. I had the opportunity recently, along with Director Lopez and other members of the health department, to engage with many faith leaders across our community, and we were impressed and grateful for the conscientiousness with which these leaders are navigating these difficult times. They're exploring innovative ways of attending to the spiritual and fellowship needs of their communities while minimizing the risk to public health. Many are opting not to hold in-person worship services at this time, which is a decision that we understand and respect. We look forward to continuing our engagement with these leaders, and we deeply appreciate the important role that they serve in supporting, connecting, and guiding our residents. To all faith leaders out there, thank you for your compassionate leadership. You are anchoring this city in so many ways, and we are grateful for your service. One of the joys of this time of year is the opening of our popular farmers markets in our community. And the biggest and oldest of our markets is the Haymarket Farmers Market, which has been serving up great food and crafts and entertainment for about 35 years. The market was set to open this Saturday, but due to an increase in our local COVID-19 cases, the organizers have chosen to delay that opening to May 16th in order to protect the vendors and the public. Linda Hubka, who manages the market, is with us today, and she'll say a few words in a minute. And when our local markets do open up, you will see some changes. We have been working with the state and the operators of the farmers markets on guidelines, which will allow them to continue to operate in a way that is safe for everyone to enjoy. Farmers markets are not considered to be public gatherings under the state-directed health measure because of the ability to create appropriate physical distancing. Yet maintaining that 6-foot distance from others will require some changes. The markets are advised to follow these guidelines from our local health department. Allow for tables and booths to be farther apart. Do not provide seating in order to discourage folks from gathering. Do not offer music and kids activities, and have staff circulate to create enforcement of this physical distancing. You will see these and other guidelines posted at the entrances to the markets. Vendors will not be allowed to provide samples, and they will be encouraged to wear disposable gloves. Food will be limited to whole produce and packaged food items. Customers will be asked not to touch produce, but to point to the items they want. Vendors are encouraged to round prices to the nearest dollar to avoid using coins and to have only one person handle the money. We know these changes are hard. They're big adaptations to make, but they're being done with the best interests of the public health in mind, and we do want to be able to allow everyone to support our farmers markets just in a new and different way. And with that in mind, I'd like to open it up to Linda to say a few words about this year's market. And thank you, Linda, for joining us today.
Hi there. Yes, we will be opening on May 16th. We open at 8 a.m. in the morning on Saturday, rain or shine at this point, provided that there's not an increase in our COVID confirmed cases. We'll turn to the media, radio, TV, maybe this avenue, if there is a need to delay the market again. As the mayor has pointed out, we're not going to be the hospitable market that we usually are, where we invite people to spend the morning with us and enjoy the music in Iron Horse Park and bring the kids. So our customers are encouraged to shop alone, probably leave the children at home, come and get what you need and be on your way. And let your eyes do your shopping and point to what you're interested in. And the vendors will be doing the packing of your merchandise, and anything is intended to be take it home and enjoy it there. We will have restrooms with hand washing stations available in the Lincoln Station and in the rail yard. And on our street, on each block, we'll have kind of a camping setup where there's a thermos with hand washing soap, water, hand sanitizer, paper towels, and our customers are encouraged to use that frequently and thoroughly. Okay, thank you. I hope you can join us and hope we can see you on May 16th, and we'll celebrate Mother's Day then, is our goal. Thank you.
Thank you. And yes, while they will be transformed in the way that we know farmers markets, it's still such an important way to be able to shop for healthy, nutritional foods. We want people to be able to take care of their physical well-being, and part of that, being able to shop outdoors where there's free airflow that is safe, and with the appropriate implementation of guidelines that we thank Linda for helping us to develop. We want to make sure people understand that this still is a wonderful opportunity, even if it isn't the same opportunity that you would recognize in shopping at a farmer's market. So again, if you want to make yourself familiar with those guidelines, please do remember to observe them and look for signage at the farmer's market when you head that way on the 16th. And now we have some good news to share. You will recall that our Lincoln Electric system announced at the beginning of the pandemic that it would suspend disconnections for non-payment, as well as fees for late payments. And LES has now announced that it is expanding its longtime energy assistance program to help those economically impacted by COVID-19. The program is administered by Community Action Partnership, and those who need help can call Community Action Partnership for details. Their phone number is 402-471-4515. And we want to thank LES and Community Action Partnership for stepping up to help families who are struggling right now as a result of the pandemic. And finally, this week is National Tourism Week. And as you all know, tourism has taken a hard hit during this public health emergency. But the Lincoln Convention and Visitors Bureau has displayed extraordinary adaptability by encouraging people to visit our attractions virtually and to postpone rather than cancel trips. We encourage you to go to the Bureau's Facebook page and check out the U.S. Travel Association's recent video on Lincoln as part of their virtual road trip. We also encourage you to take part in the Bureau's coloring contest with coloring pages of Lincoln's attractions. And with that, we'd be happy to open it up to the media for questions.
Mayor Riley Johnson with the Journal-Star. Governor Ricketts today at his press conference said that based on hospital capacity, he believes that DHM restrictions can be loosened beginning May 11th, and that he didn't plan to
Riley,
extend.
I'm so sorry, you were breaking up. Can you just repeat your question?
Sure. Um, can you hear me more clearly now, Mayor?
Yeah, I think it's our connection that's unstable, but go ahead.
Great. So the governor today spoke about hospital capacity in Lincoln and Omaha, and that he said DHM restrictions can be loosened beginning May 11th. He didn't plan to extend the current DHM in place for Lancaster County. Do you agree with his assessment that hospital capacity is the most important factor in determining whether to ease DHM restrictions?
Well, hospital capacity is an important factor. I agree that that is something that we need to be monitoring carefully because we need to make sure that we have the ability in our hospital care systems to care for not only COVID-19 patients, but other people who have health emergencies. So that is something that our health department has been monitoring and evaluating from day one, and they've also worked so hard to build capacity, and we're so proud of the fact that because of the collaboration between what are normally competing hospital systems and along with our critical care access hospitals throughout our region, that we have strong capacity here in Lincoln and Lancaster County to care for those in need. We, of course, will continue to evaluate because as elective surgeries have opened up, one of the eased restrictions, actually, there was a voluntary, hospitals voluntarily let go of elective surgeries, but as that they have relaxed that for themselves, we want to make sure that we continue to monitor capacity closely. But as we've stated, we are looking at a number of factors here locally. We're concerned about trends in our numbers. No one factor is going to be a sole determinant of our decision making, but we are looking at not only hospital capacity and our case numbers and the trend, the direction they're moving in, but also our public health capacity, our contact tracing, our ability to perform that important isolation and quarantine of those who are infected and those who are close contacts of those who are infected. And, these are so important, these factors, to making a well-informed decision. We're going to be having to do this for a long time. Until there's a vaccine, the potential for outbreaks will remain. And we're seeing one, of course, outside of Crete at the Smithfield plant. And so while we are a different health system, a different health region, and we are different counties, we have to recognize that many people in our community travel back and forth each day as a result of their work at the plant. And as those cases come back and are in our community, we want to prevent them from becoming community spread. We don't want that known source of cases to lead to community spread cases for which there is no known identifiable source that makes that isolation and quarantine process possible. I know that the governor is using that hospital capacity as his number one criteria, and we've got an expanded list of criteria, so that's just a difference that we have at the local level.
As a follow-up to that, Mayor, do you believe that you have legal authority or that Pat has legal authority as health director to enforce, the current restrictions beyond May 10th if the state would issue a DHM easing them?
Well, we have always approached this collaboratively, and we really appreciate our working relationship with the state and the fact that just, in the past we've had differences in our DHM from the state DHM. Again, DHM stands for Directed Health Measure. In our original one, we had some measures about nail salons, hair salons, barber shops, body art establishments, and licensed massage therapy that did not exist in the statewide DHM. And we appreciated the state's respect for our local variation. So there is an ability to have differences. We certainly want to be as in sync as possible with the state. We believe that clear messages for our communities matter and that they help people have clarity on what's expected and what's important. And we're going to continue to have conversations with the state as we move forward. We all have the same goal in mind, and that is to protect the health and safety of our community. Other questions?
Riley with the Journal Star again.
Sure.
You spoke earlier this week, as you mentioned, with faith, the faith community and leaders of various houses of worship about their service offerings beginning this week. Um, did you make any recommendations or advocate that they, you know, still show restraint in what they allow for public worship beyond just informing them of the recommendations, or did the recommendations sort of speak to the city's position on whether this is the best time to begin worshiping in person?
We weren't providing advice on a date or a timeline. What we were trying to do is make ourselves available, along with a health department, to answer questions, to hear what their concerns or questions or comments were. Of course, the guidelines were shared. We wanted to make sure that they have access to all of the information that's been provided by the state, as well as our local health department, in order to open up safely. But really, it was a conversation with them about, what steps they're taking, what their plans are, what they're observing in terms of the needs of their congregations. And we were there to just provide support in terms of information. We acknowledge that the statewide DHM allows for in-person worship to begin as of Monday. So in acknowledging that, we're just providing assistance as desired by them. I think one thing we did recommend was we echoed the governor's recommendation that those who are in high-risk population groups, high risk of having COVID-19 be a severe disease for them because of their underlying medical conditions or their age, is that we really urged all the faith leaders to message very clearly that it's best for those folks to stay home and to try to continue to find ways to allow them to worship from afar, because we certainly know that they remain vulnerable until there is a vaccine.
And I had a question for Pat, or Director Lopez.
You bet.
Good afternoon, Riley.
Good afternoon, Pat. Speaking of vulnerable populations, a reader had asked today, what, if any, cases has the county detected in assisted living or sort of nursing homes, or if I don't think that you've reported any sort of cases like that, but what would you say is the reason that there's, we've had very few instances like that? Is that a credit to the early measures taken by those facilities to restrict visitors?
That's right. It's those early measures they've taken, and also to restrict the visitors, but also the measures they've taken in providing their staff with the appropriate protective equipment to ensure both the staff's safety and the residents' safety. We talk with some of our long-term care every other week about what's happening, and of course, if they have questions come up, we talk with them more frequently as needed individually. But it is because they've been very proactive and taken measures, and there's a lot of information out that was learned early on. And our long-term care and assisted living in our community have really adopted those and have followed suit with that. So we've been very fortunate, but it's something we continue to monitor very closely and are very watchful about and very concerned.
Just as a follow-up to that, Riley, we convened a call today with some of our leaders who serve seniors in our community, and they asked for us to get out the message because, as of course, our seniors who are often living alone are anxious, of course, for more human contact. That is just absolutely human nature, and we all miss that right now. But as we watch across the country some of the easing of restrictions, and even here in our state, these leaders who take care of our seniors wanted to emphasize that for independent living situations or assisted living situations where our seniors have more freedom of movement, that they still need to not have visitors at this time. This is not the time to reopen to the larger public or to even their family members. And we know how anxious family members are to see their loved ones who are in these care situations, but it is important for our seniors' welfare and safety that they continue to have physical distancing from those outside of their living situations. And while we know this is hard, we know that this is important and that their loved ones will do the right thing and keep their distance for this time, but to still reach out and connect through phone, through messaging, through visits to the outside of facilities if need be. Any other questions? All right, thank you so much for what you're doing to help keep our community safe and prevent the spread of COVID-19. We'll be back here again tomorrow at 3:30.